Hello, everyone, and welcome to the third episode of our podcast, Know Your Body, Control Your Own Health. This podcast is the last part of a 3-podcast series regarding topics related to cervical cancer. Today on Know Your Body, Control Your Own Health, we are going to be discussing and breaking down the complex topic of the treatment options available for each stage of cervical cancer to make it understandable for everyone. My name is Gracie McGloin, and I will be your host today. With me today is special guest Audrey. How are you doing today, Audrey?
Thank you so much for having me, Gracie. I'm doing well. How are you?
Doing good. Thanks for asking.
That's great. I'm excited to be here today. Thanks for having me. I'm looking forward to learning something new.
That's the spirit. I love it. So today's topic might be a bit unfamiliar for you, but my goal today is to take this complex topic and make it less stressful and more accessible to you and all of our listeners. Today we will be discussing the popular treatment plans for cervical cancer, breaking down the treatment plans according to stage. Before we begin, do you have any prior knowledge about cervical cancer treatment?
Honestly, not much. I know it's a serious health issue, but the details about the treatment are kind of a mystery to me. My great-grandmother had stage 2 cervical cancer, but other than her, it really doesn't run in my family, so I don't know much about it.
No worries at all, so we can start from the basics. Cervical cancer is typically staged from 1 to 4, indicating the extent to which it is spread to other parts of the body. The earlier the stage, the less invasive the treatment will be. Have you heard about these stages before?
Not really. Could you give me a brief overview?
Of course. So in stage 1, the cancerous tumor is localized only to the cervix, meaning that the cancer has grown but it is not spread anywhere else in the body. Stage 1 can be divided into stages 1A and 1B depending on the size of the tumor. So 1A is 3 millimeters to 5 millimeters in size, while 1B is 2 to 4 centimeters. In stage 2, the cancerous tumor has spread either to the upper part of the vagina or to the tissue that surrounds the uterus. Stage 2 can be divided into 2 stages, 2A and 2B, depending on how far the cancer is spread. In stage 2A, cancer has traveled from the cervix into the upper 2/3 of the vagina. In stage 2B, the cancer has traveled from the cervix and into the tissue surrounding the uterus. In stage 3, the cancerous tumor has spread to one or more of the following places, being either the lower third of the vagina, the pelvic wall, the kidneys, or the lymph nodes. This stage can be subdivided based on the spread of the tumor in stages 3A, B, or 3C. Finally, in stage 4, the cancerous tumor has spread beyond the cervix into other parts of the body. Stage 4 is divided into subcategories 4A and 4B based on where the cancer is spread. So, in stage 4A, the cancer has spread to the bladder or rectum. In 4B, the cancer has spread to other parts of the body, such as the liver, lungs, or lymph nodes. I know that was a lot of information, but do you have any questions regarding the stages of cervical cancer?
No, I don't think I have any questions. It's a lot of information, but I like the way you explain the different stages, and it doesn't seem too difficult to understand. It's just a lot to process.
I totally understand, and it is a lot of information. Let's do a short quiz to keep the information active in your brain. Question 1. How far has 2B cervical cancer spread?
Has 2B cervical cancer spread to the tissue surrounding the uterus?
Yes, that is the correct answer. Question 2 is, when cervical cancer is in the kidneys, what is this stage?
Is it stage 3?
That's also correct. Great job. You got 100%. Now that we've covered the stages, I'm going to move on to treatment options now. So please stop me if you have any questions along the way. So for stage 1, the most common treatment option is surgery. As far as surgery goes, you have a few options. A cone biopsy is a surgical procedure that removes a cone-shaped piece of tissue from the cervix. A radical trachelectomy is another surgical procedure that removes the cervix and lymph nodes in the pelvis. These are great options for women with cervical cancer who want to have children in the future. Other treatment options for stage 1 include a total hysterectomy, which removes the cervix and uterus, or surgical removal of lymph nodes in the pelvis or back of the abdomen. Finally, radiation or chemoradiation can sometimes be used for women who do not wish to undergo a surgical procedure.
Wow, surgery sounds intense for such unadvanced stages. What does treatment look like for stage 2?
Great question. So in general, for stage 2, the most common treatment option is chemoradiation. This is where chemotherapy and radiation therapy are given in conjunction with each other. Similarly to stage 1, surgery is also a popular treatment option for stage 2. Generally, in stage 2, the most common surgical procedure involves removing the lymph nodes in the pelvis and or back of the abdomen. In this stage, surgery is also commonly followed by radiation or chemoradiation to ensure the cancerous growth is entirely removed.
So chemoradiation and surgery is the most common type of treatment for stage 2 cervical cancer. Got it. But what if the cancer progresses further?
Great question. So as the cancer progresses into stages 3 and 4, more aggressive treatment is typically required. This is because in these stages, the cancerous growth has spread to other places in the body. So the goal of treatment is not only to treat the cancer in the cervix, but also address the spread of cancer to other places in the body.
So for these stages, the treatment options become a bit more comprehensive. How do doctors decide on the best treatment plan?
So as the stage of cancer progresses, the treatment becomes not only more comprehensive, but also more individualized. So in other words, it depends on a variety of factors such as the patient's overall health, the growth of the cancer, and patient and physician preference. In general, however, the most common treatment options for stage 3 are chemoradiation compared with brachytherapy, which is another form of radiation that is directed as close to the cancerous growth as possible, usually with wires or rods. Treatment could also include radiation directed towards the pelvic lymph nodes or surgery to remove the affected lymph nodes.
That makes sense. The treatment plan for this stage definitely seems more comprehensive than previous stages. What does treatment look like for stage 4?
So for stage 4, similar to stage 3, the treatment options are more comprehensive and also more individualized. Chemoradiation is a common treatment, as is brachytherapy, the removal of lymph nodes, targeted drug treatment, immunotherapy, and radiation. Since this stage is so advanced, patients might be willing to participate in clinical studies to find treatment as well, or they may choose to undergo treatments merely with the hopes of controlling their symptoms rather than finding remission.
Yeah, that makes sense. Is there anything else our listeners should know about cervical cancer treatment?
Of course. So the good news about cervical cancer is that it is preventable. In fact, the CDC says that up to 93% of cervical cancer cases are preventable. So things like regular screenings are crucial for early detection. And of course, vaccines such as the HPV vaccine play a large role in preventing cervical cancer. It is important for everyone to be informed and proactive about their health.
Thanks for breaking down such a complex topic for me. I've learned a lot today.
You're very welcome. I'm glad we could shed some light on this important subject. And to our listeners, thank you for joining us on another episode of Know Your Body, Control Your Own Health. Information included has been sourced from the CDC, Cancer.gov, Cancer Research UK, and Johns Hopkins Medicine. If you have any questions or topics you'd like us to cover in the future, feel free to reach out. Until next time, stay informed and stay healthy.